Let us now go to visual diagnosis of the fingers. The topic is swollen fingers. The most obvious and common cause of swelling of the fingers is painful obstruction syndrome from dampness, which may be cold dampness, wind dampness, or damp heat. Other causes of swelling of the fingers include blood stasis or edema, which in the case of hands is due to deficiency of yang of the lungs and spleen. In the elderly, swollen fingers may also be due to liver and kidney yin deficiency with blood heat. Here we can see a picture of what swollen fingers look like. When swollen fingers are due to cold dampness, painful obstruction syndrome, there will be pain of the fingers that is aggravated by exposure to cold and damp weather, and alleviated by the application of heat or by exposure to dry weather. And the hands will also be cold. For swelling due to damp heat, painful obstruction syndrome, there will be heat and pain of the fingers that is aggravated by exposure to damp weather and alleviated in dry weather. For swelling due to wind dampness, painful obstruction syndrome, there will be pain of the fingers that is aggravated by damp weather, and there will be itching of the hands, and vesicles on the skin will be visible. For swelling of the fingers due to lung and spleen yang deficiency, the hands will also be swollen and it will be pale and cold. There will be poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, feeling cold, slight shortness of breath, slight cough with profuse watery sputum, and a weak voice. There will also be spontaneous daytime sweating, dislike of speaking, bright white complexion, propensity to catching colds, tiredness, dislike of cold, a feeling of cold of the upper back, absence of thirst, with a pale and slightly wet tongue and a deep weak pulse. For chi stagnation, there will be swelling of the fingers before the period in women. There will also be hypochondrial or epigastric distension, irritability, moodiness, a feeling of a lump in the throat, premenstrual tension with a wiry pulse. If swelling is due to blood stasis, there will be severe pain on the fingers. There will be contraction of the fingers, dark complexion, purple nails with purple tongue. The pulse will be wiry or choppy, and other symptoms and signs depend on the organ involved, which in this case may be the liver or heart. For liver and kidney deficiency with blood heat, the fingers will be swollen, red, and hot. Conditions that are aggravated by exposure to heat, like numbness or tingling of the limbs, dizziness, tinnitus, hardness of hearing, dull occipital or vertical headache, insomnia, malar flush, dry eyes, blurred vision, lower backache, dry throat, dry hair and skin, brittle nails, night sweating, dry stools, scanty menstruation or amenorrhea, five-palm heat, a feeling of heat in the evening, the tongue will be red without coating, and the pulse will be floating empty and rapid. For wind water invading the lungs, there will be sudden swelling of fingers and face, gradually spreading to the whole body. There will be bright shiny complexion, scanty and pale urination, aversion to wind, fever, cough, slight breathlessness, sticky white coating on the tongue, and a slippery and floating pulse. Thank you so much for your attention.